I'm going to talk a little bit today about the endocrine system and how it relates to chemical sensitivity. And it's certainly, the endocrine system is certainly concerned with the homeostatic control of various metabolic functions in the body. And I thought I would review that, so that such as the rates of chemical reactions in cells, transport of substances through cell membranes, and cellular metabolism and growth and synthesis and secretion. It certainly are essential for vascular regulation and response, and therefore one has to take this in consideration when you're looking at chemical sensitivity, because sometimes if the hormones are not right, why you can have a lot of malfunction of the chemical problem. And of course, it's also related to immune function, and so therefore we have to consider that aspects of it. Now, the endocrine system is one of the major amplification systems for homeostasis, and of course, as we try to see patients, that's what our goal is to restore homeostasis, both in all systems, and this is sort of a triangle of endocrine, immune, and neurological systems. I'm going to start and dissect each gland first, so that we can get a feeling of this. But of course, the pituitary gland is all these different hormones, thyroid stimulating hormones, the female hormone stimulating, melatonin stimulating hormone, and so on. And then, of course, in the posterior part of the gland, you get the oxytocin, vasopressin, and so on. This is just an anatomical drawing, and of course, if you get pollutant overload, you can have autonomic dysfunction, as we talked about yesterday. And but also, if you look at the pituitary, there's one side of it, the anterior pituitary, which has a capillary plexus, which is quite intimate and is quite necessary for, again, good immune function and good homeostasis throughout the body. So if you don't have those blood vessels working right in your pituitary, you may have changes in all of these substances, like the acidophil substance that puts out LTH and somatotrophin, and the different thyroid functions, ACTH, FH, and so on. So it's much more dependent on the vascular tree than is the posterior pituitary, which is for the oxytocin, and it's made out of the neural crest. So this is where the endocrine and the neurological system come together in the body as part of the master control function of the body. Now, there's many effects of toxic chemicals upon the pituitary, and we can't go into them all today because there's so many of them. However, there are false neurotransmitters. For example, alcohol mimics different neurotransmitters, and GABA. LSD, of course, will do a mimic, and so on down the line. And then the other thing that the toxics can do is that it can actually stimulate abnormal levels of neurotransmitters. And if these levels are abnormal, of course, we'll have either a hypo or hyper function of that. And so I like to look at this, if we are going to look at the thyroid and the adrenal gland and the pancreas and the different cells there, that they're all mediated in the nerves and blood vessels, but they'll have dysfunction of each one of these glands. And also there are many neuroendocrine cells. For example, at the bottom of the aorta, there's a whole nest of neuroendocrine cells that can be triggered by this. And of course, it's true of the upper vascular tree also. Now, many chemically sensitive people have trouble with sleep, and they either are sleepy all the time, as some people in this room used to be, and some people can't sleep. And that's a real problem because probably either dysfunction is not too compatible with optimum function and homeostasis. Also, also the sexual reproduction cycles have to do with the natural biorhythms, which the pineal gland does. And of course, the sleep-awake cycles we talked about. And it also influences immune function, particularly T cells during the night, and the suppressor T cells, which are usually decreased in the chemically sensitive individual. And these apparently are restored during the night. And if you don't get enough sleep on them, the chemically sensitive individual will have suppressed T cells. And this can, of course, really lead to dyshomeostasis. Now, many chemically sensitive patients do have insomnia, and they have pineal gland damage, and which is probably part of the homeostatic mechanism. The propensity of a sympathetic response. When a pollutant comes in the body, the first response is the output of adrenaline, and that occurs in 80% of the patients that we see by measurement, and I'm sure it occurs in 99% of the patients that we see, but the measurement devices aren't quite as sophisticated to show that yet. And so apparently the adrenaline is put out so that the vessels spasm, and you get a walling off of the area where the pollutant enters, with the idea of not dispersing it to the rest of the body. So it's a local homeostatic protective mechanism, and we want to recognize that. So if this epinephrine can be put out through the nerve roots and the distal nerve endings, as well as in the adrenal glands. And so we have a dual response here to pollutant injury, and what we will have is a lot of times to get dyshomeostasis of not only the nerves, but dyshomeostasis of the endocrine system and the adrenal glands with this idea. So the pollutants can lead to adrenal malfunction because of the cord reflex or the reflex of the sympathetic nerves, celiac ganglion, and so on. And then they can have other endocrine malfunction also. And in reverse, they can have neurological dysfunction because of this output of epinephrine and immune deregulation, as we said. And as one well knows when they've studied anatomy, there are, of course, several zones in the adrenal gland. And with the pollutant injury, you can have excess stimulation, then depletion and inhibition, and the big one is deregulation of the adrenals. And of course, you have the capsule, the zona glomerulosa, the aldosterone area, the cortisol area, and then the autonomic fibers for these things. And of course, each one of these give malfunction of certain other things. For example, there's a lot of independent renin, angiotensin, causing high blood pressure and causing the secondary pollutant response. And you have to have enough cortisol for the optimum conditions. And this is Marty Paul's area, and I don't try to get into it being a surgeon. However, there are mineralocorticoid pathways, glucocorticoid, and androgen pathways, and they all sort of mesh together with complicated benzene rings here. And you can see that happen here with the female hormones, the estrogen, progesterone, adrenal, testosterone, the whole great gamut. Now, we have measured a lot of patients, and this is a gram of the normal control and then a patient response. And you can see here that the patient response is hard to get going in the morning because they should be up here when they're down here, and or just the opposite. They're real high in the morning and low at other times. So we have our swings with our endocrine system that can cause problems. And these are just showed graphs of how patients are different responses. We have people, we have morning people, we have noon to afternoon people, and then we have night people. There are about 3 different types of patients that we see. And there are some people who just can't get going in the morning. And then there are other people who about noon, 1 o'clock, they start turning over. And then the third group, almost always at 5 o'clock in the afternoon, suddenly they are much better, they're awake more, and they can get their different functions better done at that particular time. And this graphs just shows these different things. Now, the mechanism of hormone control in the cell function is quite interesting because it's a very complicated bit of biochemistry, and you can get the stimulating hormone on the cell membrane, and then you trigger off the adenyl cyclase and the ATP. And these physiological responses are they activate enzymes, they alter cell permeability, allow edema on one end, and you have a lot of edema from the patients that are chemically sensitive. Their feet swell, their face swells, their ears swell, their tongue swells. I think their chest swells at times, you know, and their GI tract swells. So you get this different leaky gut type problem in any vessel system in the body. You also get the muscle contraction or spasm, or the muscle relaxation where they don't want to do anything. And so we have a lot of problems and see a lot of patients that have that going. And of course, the protein synthesis can be a problem also, as can cause excess or secretion or other type things. Now, many chemical sensitive patients are thought to have adrenal insufficiency, and they may show adrenal regulation. We find that few show true adrenal insufficiency. They're more deregulated. Some of them may need a little cortisone, maybe 5 milligrams or so, or 1 milligram or 2 milligrams, just to balance their system. Very few need the total adrenal replacement, although there are cases that do need that. And I think that we've seen this in the different areas, and it makes sense anatomically, as I showed before, how the different areas of the adrenal can be malfunctioning, and the other areas be functioning very well. Pollutant injury to the outer cortical layer, of course, gives also high blood pressure or low blood pressure. Our predominant group of patients with chemical sensitivity will have high blood pressure, but the other group has very low blood pressure, and they'll be 90, 80, 70. I've seen them even 60 over 20, and those people are in real trouble because of the fact that they just can't generate enough vascular response to oxygenate the tissue as well as it should be. So these type patients, it's difficult to treat. For one thing, they usually can't sweat. And so therefore, you have to try to find a reason to train their body to sweat again, because it's a good detoxification mechanism. However, a person with a blood pressure of 70 over 50 has trouble in a sauna, because if they leak a little bit of fluid, they have trouble. In some of these patients, you have to give like a liter of salt water per day for a while until their blood pressure starts coming up, in addition to lowering their pollutant load. And you also have trouble doing skin testing and endpoint neutralization with those type patients until they get better. Now, some of the pollutants that cause this adrenal excess are pesticides, and they screw up some of the hydroxyl enzymes. And we found this in a group of Puerto Rican children who were aged 2 to aged 10. And they had a real disaster in Puerto Rico where they fed chicken a toxic substance, and even the mothers had eaten this chicken and passed it on to the babies. And then when the babies started eating the chicken, they had an epidemic of hyperadrenalism and hypoadrenalism that was clearly environmentally triggered. And once you could get these kids worked up,
get them away from this contamination, no problems. And of course, the other one that we haven't talked about much is myocardial ischemia. You've got to remember, if you can't generate enough blood pressure, you will get myocardial ischemia, or as well as cerebral ischemia. And you can get myocardial infarctions from this, and we've seen that in many patients. And I think the most talked about problem with chemical sensitivity is the cardiovascular system, and probably one of the most important, since you just have to have a pump to live, as we well know. And of course, there are a lot of endocrine mimics and endocrine stimulators, and most of them, these are the chlorinated pesticides. And you know, we say DDT, well, we don't use anymore. There's only one problem. DDT has a half-life of 150 years, or 50 years, so therefore it'll go on for 150 years. And so we still see many patients who have high levels of DDT, and clearly are triggering part of their problem. Hexachlorobenzene. You can't believe the literature on what what the chemical companies or the toxicologists say on the half-life of these chlorinated hydrocarbons. And the reason is they're done in normal animals and not abnormal humans. And so you may have a half-life of 4 hours for hexachlorobenzene, but you may have it for 4 years or 40 years in a chemically sensitive patient. And that's the problem. And the problem is communication a lot of times. Again, as somebody said yesterday, a lot of these things are propaganda when it comes out of the toxicology literature. So one has to be careful when they're talking about half-life. Chloridane, which is used about in 50% of the houses for termite proofing in the southern United States. And I had a case of a little girl with severe anaphylaxis. She was out in the country, but there was a little development. Unfortunately, her next door neighbor was a pediatrician, so he kept supplying the adrenaline to resuscitate her when she went into severe bronchospasm. Well, we finally saw this little girl, and she was peanut butter sensitive, and she was so sensitive that one day in the office there was another child who had eaten a peanut butter sandwich, and her breath caused the child to get anaphylaxis. Of course, we resuscitated her right there, able to stop it. But that was her big sensitivity. The question is, why did she have peanut butter anaphylaxis? Well, we got her house analyzed, and we found there was a crack in the cement. It was a house with no basement, and that house had chloridane placed under there for termite proofing. And the only thing she had in her blood of toxic chemical was chloridane. And so we got her clear of the chloridane in her body, sealed the cement in her bedroom, and she has gone, her peanut butter sensitivity has gone down. Now she can go to school because she never could go before because of the kids eating peanut butter, and now her peanut butter sensitivity has gone down, and she has done well for about 10 years without any recurrent anaphylaxis. So it was a detective work of finding out about this type phenomena and finding out what is the cause. And I think the question everybody should always ask is, what is the cause? What is the cause of this sensitivity? What is the cause? What is the underlying cause? What's the underlying cause? And if you can do that, you can find it. Now, we have a lot of people who have high calciums, and a lot of them are marginal. And the problem is that you can have a normal calcium up to 10.6 and have a calcium at 10.7, and it means something in some people. And we've found several parathyroid tumors that were in this very low range. Of course, the high ones are much more obvious. So, you know, the parathyroid certainly can be involved and cause kidney failure or cause the other problems. So the ovaries, the biggest problem there is, of course, I believe, in the endocrine system. And they're particularly susceptible to early pollutant injury, and they can be either increased or they can be decreased. And if, of course, the pituitary involved, stimulation of the LH-FSH. And then you can get estrogen stimulation, progesterone, and of course testosterone problems also in the female, because many females we see do have problems at mid-cycle with testosterone. And if you don't neutralize it, they a lot of times won't get wetter, or if you don't lower the total body load. And so I'll always remember about the integration of all of these glands in the function. Now there are pollutants, again, causing dysfunction, and lindane, which is still used for head lice, I think, in the United States. I don't know about Europe. Is that true in Europe too yet? That they use it for head lice? They quit using it, have they? We still have a lot of problems in America with lindane. Organophosphates now. I'll replace it with a great one. Causes as much problems as that one. And of course benzene is a great problem with ovaries. So is the polyaromatic hydrocarbons, the alkalizing agents, hair dye, and the new safe pesticides, pyrethroids, can do the same thing, as well as the organophosphates. And I think the other thing we have to realize that mycotoxins can cause ovarian dysfunction, and there's a zearalenone and several hormone mimics that the mycotoxins cause. And I think we tend to overlook these because a lot of times the technology is not quite there for these things to measure them. But you can't forget it. And if you neutralize for these, of course, a lot of times you will help people. The dioxins and the phenoxy herbicides are still being used. And of course, the new one, a kid on the block, but probably it's not new now, are the marijuana type substances that can screw up ovarian dysfunction. In the testicles, really not much different as far as the chemicals go, and they can cause testicular dysfunction also. And also you can have 40% now have less sperm and have small testicles of the males in this world. And it's, you wouldn't think it was a problem since our population is mushrooming, but it will become a problem in the future. Small penises, hypospadias, undescended testicles, feminization of the males. They're much more bisexuality and homosexuality now. And women with single, double, triple, quadruple miscarriages that seem to occur, seem to be gone on with this. Now, some of the other pollutants that will give you both hyper and then hypothyroid, this seems to be the big problem, is that thyroids burn out. And all of these substances can cause this, but I want to point this out. Plastic containers, plastic liquid containers, plastic water bottles, plastic juice bottles, all can put out phthalates, which can mess up the thyroid. And so there's no wonder there's such an increase. However, on the other hand, only 20% of our chemically sensitive people have this thyroid syndrome. And you'll have patients come in and they're cold and their temperature's low and they look like they're thyroid, but 80% of those are due to other chemicals rather than hypothyroid. So we want to never forget that particular thing. And again, you can see this, but also excess iodine can cause it, and so can excess lithium. And of course, we have a lot of problems with the radioactive material that's coming around the world. And if you look at the studies of the Russian disaster or Chernobyl and the now you'll see the Japanese disaster coming out, this radiation circles the Earth, and it's in zones. And in the United States, when we had Chernobyl, all of the upper part of the country had radiation in them, and they had the milk from the cows all had radiation in them. And of course, it was below any toxic levels. It was all very safe. We know that because our government told us that, you know. Okay, the thymus gland, which regulates the immune system initially, but peters out by its peak time is about 28 years, and by 40, most of them are gone. And where that other secondary system is, nobody seems to know yet, but something takes over for that. So the T cells go to the bone marrow from the thymus, and they go to the bone marrow. And then they develop the diversity in the thymus gland and are for cellular immunity. Now, this is just how the reactivity goes, and I think that's sort of standard medicine now. Pollutants that can injure this, of course, besides radiation. And at one time in the world, you know, they radiated the thymus gland because it was too big in children, and that was after radiation came out. And we've seen a few of those patients who got radiated their thymus gland, and they were also severely chemically sensitive because of the iatrogenic radiation. And then we've talked about all that. Now our final thing is the pancreas, and we have both the exocrine and endocrine problems in the pancreas. The exocrine seems to be secondary to GI toxicity, but the endocrine seems to be involved with the other bits of the neuroendocrine system. And I don't know about in Europe, but the diabetes is skyrocketing in America. And I think it's clearly due to pollutant injury. And I think that there's no talk about that as there should be. We've got that it occurs mostly in the beta cells, and the epidemic is there, and there's damage to glucagon cells and somatocells and pancreatic polypeptides also. And things that the original one was aloxin, but formaldehyde is a big trigger of the endocrine pancreas, and of course our problem in the United States is all the sheetrock for the inside of the house is full of formaldehyde. And the Chinese, of course, have added a lot of junk, and you can't even use Chinese wallboard now because of that problem. Some of the glues, the phenols will do it. Well, a lot of things have phenol in it, and glues have it in. And then the pesticides that are used. And of course, we all drink chlorinated water except a few people in Europe where they have a different type, and a lot of people are exposed to ethanol. So these things can cause the endocrine pancreas to have problems. And these are just more pancreatic disruptors, and you can't even read it, so I'm not going to go on. Now, one has to know that the cardiovascular effects are dampened by estrogen, and women have their heart attacks at least 10 years over a male. Because the testosterone masks the pollutant injury, and so they wait until you get severe heart attacks and vascular lesions, but the females can go on longer because they change at a later time. And I think what I'll do, since my time is up, I did want to put one thing. Inflammation of the blood vessels. Clearly thrombophlebitis is caused by pollutant injury. We described that 30 years ago and published it. And so vascular disease in the blood vessel wall is very important in looking at these different endocrine malfunctions. So with that, I would like to conclude, and I guess the summary's here, that many environmental incitants disrupt the endocrine system. Therefore, they change homeostasis. They amplify the local homeostatic response. That's one of the problems with their amplification system, just like the neurological and the immune system. And knowledge and elimination of the pollutants will restore endocrine function. Thank you very much.